my name's Carly. I'm a student nurse from RCSJ. I'm just going to be giving you an assessment today. I'm going to do some hand hygiene and put on some gloves first. First thing I'm going to do is take a little look at your head here and just measure the circumference. Should be about 34.5 centimeters, and you're at about 34. Okay. All right, next I'm just gonna flip you around, little bud, so I can look at your head, and I'm just gonna assess for the anterior fontanelle, which is diamond in shape, and your posterior fontanelle, which is triangle in shape. And what I'm gonna do, I'm just gonna feel around them, look for bulging, depression, could be an indication of dehydration, and just checking the suture lines for any molding, and just looking at the overall skin and making sure it's intact, I mean. Right, next thing I'm gonna do is look at your eyes. I'm just checking them for swelling, puffiness, conjunctiva, looking at your scleras, making sure they're white, and just making sure they're symmetrical. Next thing I'm gonna do is take a look at your nose, just checking that it's not flattened. That could happen during birth. And just looking at the patency of your nostrils. If you had some snot, I would just suction it out with a bulb. Right, I'm going to take a look at your ears, just checking for drainage, and checking to see that the pinna of the ear is symmetrical to the end of the eye, or the external canthus. Checking on both sides, and then symmetrically. Right, take a little look at your mouth, bud, and just checking that the palate's intact, and if you have any little pearl-like cysts, which could be Epstein pearls along the lining of your gum, which are benign. Okay. Next, I'm just going to look at your neck, just range of motion, looking at the folds, and I'm going to go down and examine your chest. I'm going to start with circumference. Should be about 30.5 to 33 centimeters. Okay, I'm just going to take a little listen. Sorry, Spike. Just warm this up for you. Right, so I'm going to do my eighth demand. And then I'm gonna find my point of maximum impulse about 4 intercostal spaces down, and I'm gonna listen to it, make sure S1 and S2 are present, and I'm also going to take your pulse at this time. Right, and I just did it for 30 seconds, and I'm gonna multiply it by 2. I got 135, and it should be anywhere from 110 to 160, right? And while I'm down here, I'm going to listen to your lungs as well. Okay, I'm going to listen to your back as well. While I have my stethoscope on, I'm just going to take a listen to your bowel sounds. Make sure that they're active. I'm just going to count your respirations. Whoops, sorry, Spike. And I'm checking to see that they're anywhere from 30 to 60. You're at like 33, so you're all good, bud. And I'm just going to go ahead and palpate your abdomen as well for any masses, distension. There you go. And then I'm also just checking the skin as I'm going through all this, just looking for any discolorations or variations. Okay, now I'm going to check your arms. Watch out, bud. Check your brachial pulses symmetrically. And I'm just gonna check that you got all your toes or your fingers. 1, 2, 3, 4, 5 on each paw. And I'm also gonna check your legs, that they're symmetrical in length and that you have all your toes. Okay. I'm also going to be checking to make sure that your anus is here and if you've had any meconium or stool yet. No. And then I just want to check the skin on your back as well. So no pallor, normal skin color, no jaundice. Right. And then I'm just going to go ahead and I would check your genitals. I'm not going to violate you, my little puppy, but I would just look for the position of the meatus. Make sure that it's at the tip and it's not swollen or inflamed or red. I'm also going to make sure that you have testes and just check your scrotum for rugi. Okay. And then I'm just gonna check your spine as well. I just want to make sure that there's no deformities, that it's curved shape, and there's no lesions or masses, no dimpling. Right. And then I also wanted to check your gluteal folds by your butt, just make sure that they're also symmetrical as well. And then I'm actually going to flip you over again, buddy. All right. Oh boy. I'm going to check your hips for clicking. Okay, and then I'm also going to check some reflexes on you. Okay. So the Babinski is checked by running a finger up there, up the sole of the foot to check for toe curling. And then we also have the stepping reflex. So I'm going to hold you up and your feet should step on, try to touch the flat surface. All right, good boy. And then I'm going to check your Mora reflex. So I'm going to sit you up and drop you back a little bit to see if your arms flex. They did, yay. Okay. All right. And then the rooting reflex. I would stroke the corner of the mouth to elicit sucking, or to elicit opening the mouth. I'm sorry. I'm also going to check your palmar reflex, which means I'm going to put my finger in your palm, and you're supposed to grasp it with your fingers. And then we also have the tonic reflex. I'm going to set you down again, bud. Right, so you would turn the head to one side and the body should act like it's fencing. Right, and then one more is the plantar reflex, and I just place my thumb firmly against the ball of your foot and your toes should flex tightly down. All right. And that's it. You're all good to go, bud.